My name is Darren. I'm here to share with you some of my hopes for healthcare. For 30 years, I worked in risk management and client relations, supporting teams to prevent situations of harm or dissatisfaction, to mitigate harm when identified, to engage in fair and timely remediation of any claim or complaint, and to catalyze quality improvement from each situation. I've worked with stellar teams in a role that a colleague once described as being a crisis walker, supporting clinicians, staff, patients, and families through what for them would be a unique, or at least infrequent, crisis in their career or journey in healthcare, such as a complaint, serious patient safety event, or formal claim. As of the spring of last year, I'm now a full-time patient, beginning with an experience that etched into my soul what had throughout my career been a sincere but less personal commitment to quality. My attending nurse practitioner, Monique, sat down on my bed, took my hand, and told me my CT was suspicious for malignancy. Over decades in risk management and client relations, I've worked through innumerable adverse events and situations. In 18 months of consistent excellence in care, initially at Vancouver General, and more fundamentally at BC Cancer, I've come to learn and intensely appreciate that my work-informed view of the patient experience is not universal. I have many hopes for healthcare, some general and some more personal. The first hope is that the patients respect the unfathomable energy, dedication, skill, and compassion required in providing care. Fellow patients, chances are everyone's having a bad day. We're in this together. I hope organizations nurture quality-focused, diversity-rich, respectful, and toxicity-free workplaces in practice, as well as on the website. Less undermining, fewer sideswipes, more respect, lifting up, and gratitude. And by organizations, I mean everyone, bedside to boardroom. Live it. I hope organizations truly live their vision, that they are sincerely focused on promoting health for their communities and providing quality health care for each patient, and that they strive to achieve this vision by resourcing, supporting, and rewarding staff as critical partners to that end. I hope staff are supported to nurture their clinical expertise and sustain perseverance, compassion, and art of care in general in order to foster a collaborative environment for their colleagues and a positive patient experience. Colleagues, chances are everyone's having a bad day. We're in this together. I hope that our system will be less subject to political caprice, and I hope that it provide fair and timely access to quality services, optimal leveraging of scope of practice, fair compensation and quality of working life, and draw on sustainable investment among the myriad other commitments of public spending. Some of these comments that follow have been the stock of buzzword bingo over various initiatives during my career, but do reflect my learning as a patient and translate to hopes for healthcare. First off, there's an outstanding number of parts, many of them moving parts, and the system is very difficult to navigate. I hope that we can help patients and families, and let's be honest, clinicians and staff, better understand the myriad of service options available so that each need and opportunity we can identify all of the relevant point Bs and learn and explain how to get there from point A. I hope that providers and teams listen and hear and process what the patient is voicing. We know our symptoms. We rely on you to understand and apply the science. Having our concerns disregarded is not only disrespectful, it's dangerously misleading in a clinician-patient relationship and can be catastrophic. I hope the patients are able to effectively organize and communicate their concerns, and I hope for them to maintain a wary trust in their providers. If we feel that our providers are not seeing the big picture or they're focused on the license plate of the car, that we have the opportunity to politely but firmly ensure that our concern is addressed. I hope that consent is a full exchange of critical information. Patients want and need to know about mitigation strategies for anticipated impacts of their care. There are things I learned 6 months after starting therapy that would have significantly improved my quality of life had I known from the outset. I hope that clinicians, particularly consulting providers with fulsome knowledge, can be truly present with the patient to illuminate and explore concerns with the care options and to explain the road ahead, or at least direct patients to existing patient support resources, which in my experience have been so very helpful. I hope that we make space for bad news, the VGH emergency and internal medicine providers initially, and since then the BC Cancer teams have had more than their share of bad news for me. Seems in my cancer we found something more aggressive than my driving. The news has, without fail, been delivered with compassion, precision, and an open space for dialogue. A connected team is an effective team. I cannot speak highly enough about the awe-inspiring communication among, within, and with the teams at BC Cancer. I've been engaged as a full partner, been heard and responded to, and consistently amazed at the clockwork swiftness and thoroughness of communication across teams and with me. I acknowledge the system is mind-bogglingly complex. However, I maintain hope that we can sort a way to learn from and emulate that clear, effective, and timely communication, including the sincere integration of the patient into the conversation. I know I'm not unique in my encounter with cancer or in receiving consistently responsive, expert, and compassionate care. But I do think I have a rare perspective on the stark contrast of my journey with that of those who experience patient safety events or whose care has motivated them to file a complaint. It's my hope that one day we, organizations writ large, individual staff, and patients and families can experience the clinical excellence, integration, openness to dialogue, and compassion that has been my good fortune. Thank you for your attention today and for your commitment and service to quality. Live it.
Thank you.